Good afternoon, everyone. Welcome to today's webinar, Achieving Success and Safety by Implementing a Trauma-Informed Approach in Juvenile Services. We're glad to have you join us. My name is Bonnie Zampino, I'm the Engagement Specialist at Ukeru Systems. Before we get started, I'd like to go over a few housekeeping items so you know how best to participate in today's event. So we've taken a screenshot of an example of how the attendee interface looks. You should see something that looks like this on your own computer desktop in the upper right-hand corner. You're listening in using your computer's speaker system by default. If you would prefer to join over the phone, just select the telephone option in the audio pane, and the dial-in information will be displayed for you. We are eager for this webinar to be as interactive as possible. You will have the opportunity to submit text questions to today's presenters by typing them into the question pane of the control panel. You can send in your questions at any time during the presentation today. We'll collect those and address them during the Q&A session before we end today's webinar. In addition, we welcome you to join us throughout this conversation on Twitter by using the hashtag #StartsWithYou. A few other items we wanted to make you aware of. For those of you who need a certificate or continuing education credit for this discussion, we can make that available to you upon request. Continuing education credit is available through Shepherd University with an associated fee. In addition, a copy of this presentation will be distributed in the next few days. We are also recording this conversation and we'll post that on our website later this week. Next slide. The topic of juvenile justice reform is one that is very important to us here at Ukeru Systems. If you've attended one of our webinars in the past, you know that we focus a great deal on trauma-informed care. For individuals who've experienced traumatic events, such as violence and victimization or physical abuse, the impact of re-experiencing that trauma through the use of restraints and seclusion can be devastating. Children in detention inevitably experience a great deal of trauma. Supporting these individuals requires taking all of this into consideration, identifying triggers, and using trauma-informed approaches. So today we are lucky to be able to hear from Anders Jacobson. Anders became the director of the Office of Children, Youth, and Families, Division of Youth Corrections in 2016. He has worked in the juvenile justice field for 23 years, with 20 of those years spent in leadership roles at residential units and facilities operated by the state and in the private sector. We are also fortunate to have with us Kristen Withrow, who is the Associate Director of the Division of Youth Services, both in Colorado. And at this point, I would like to turn the discussion over to Anders and Kristen. Thank you both so much for being with us today.
Thank you. It's our pleasure to be able to have the opportunity to present and to participate in today's webinar. Always a pleasure to engage with colleagues across the country to discuss, in this case, some of our successes that we're having, but also struggles and areas that we continue to work towards improving, which is always our ultimate goal. And today we're going to talk to you about our implementation of innovative practices, new procedures, policies we've put in place to improve the client experience, and most importantly, as we transform our correction system into a service delivery system focused on a trauma-responsive environment for both youth and staff. So if we go to the next slide, and what you'll see here, as you inch forward, please, there'll be 4 pop-ups that come up here. We really looked at our first step in developing our strategic plan to move forward towards a trauma-responsive environment. And so Number one, we wanted to make it as simple as possible. Although it was a heavy lift for our organization, leading 1,200 staff, we knew that we had to have a strategic plan that was something that they could read and consume. And when I talk about simplicity, it's a one-page strategic plan. It has one goal and 9 objectives. Focusing on our core mission within youth services, which is to support our youth and families that we come in contact with. If you tap a couple more times, please, you'll see that the overall focus around positive staff and youth outcomes was important to us in our strategic plan development, and then organizing around safety. And when I talk about safety, I'm talking about physical safety, psychological safety, social safety, and moral safety as areas that are the foundation to moving forward with our trauma responsive environment. Next slide, please. So we're going to talk to you about our foundational principles. We go forward here. So the vision was changed as we moved forward, and very simple, and it's about achieving youth success, and it's about creating safer Colorado communities. The mission, you'll see again, is protecting and restoring, improving public safety. So effective supervision, certainly working with our youth, but also working with communities and victims. But most importantly, leading constructive lives through positive youth development. And of note, the Colorado Division of Youth Services, we serve both committed youth in our system as well as detained youth. And so detained youth are with us on an average of about 15 days, whereas committed youth are with us generally between their sentences 0 to 24 months. So what you see in front of you now is another foundational piece in our system. We engaged with the Sanctuary Institute out of New York almost 4 years ago to come in and help us understand how to move forward with a trauma responsive environment, to train our top leadership in the division, as well as train our staff and provide ongoing and on-site consultation. And so these 7 commitments are commitments that we, again, utilize as our foundation, that we operate from, both youth and staff together. Next slide. So our key strategies as we move forward is that we always provide the right services at the right time for each youth in our system, that we always want it delivered by quality staff, strong focus on proven practices, that we maintain safe environments across our division, and that we're embracing and utilizing restorative community justice principles. As again, 5 key strategies that we refer back to in decision-making and working with young people. Next slide. So as I stated a little bit already, the division, we moved forward again with our strategic plan, and we came out with one specific strategic goal. The division will operate healthy trauma-responsive organizational environments demonstrated through pro-social, safe, and nonviolent interactions. And so that is, although one goal, it was a lofty goal for us. We are changing a correctional environment to a youth services environment, and so we wanted to make sure that we didn't bite off more than we could chew. Typically, strategic plans, and unlike ourselves, can be multiple pages long. And in fact, when we put together our original strategic plan, it was just that. But we really felt like that our staff needed something that they could understand and was simple, easy for them to grasp, and that the concept for them was doable. Next slide. So under that strategic goal, we have 9 strategic objectives, and I'm going to go through these fairly quickly, but just to give you a little bit of an idea around how we built our foundation and moving forward. So first and foremost was freeing up our facility leadership so that they can spend more time with staff and youth. And this is simply about allowing them to lead by example, allowing them to be out and about within the milieus, to talk and work with youth, and to talk and coach staff along the way. Number 2 is creating small group processes to address behavioral issues, which essentially is ensuring that we're engaging the overall milieu for support and problem solving when issues arise, as opposed to always dealing with individual behavioral issues on their own. It would take staff away from others in the group and what was going on in the milieu. And this process really allows for everyone to be engaged in support and problem solving. Number 3 is transforming our youth centers to be more home-like in terms of the atmosphere. And this is something that we've had a pretty good jump on, although with 10 state-operated youth centers across Colorado, we're really talking hundreds of thousands, if not millions of dollars to totally transform a correctional environment to a home-like atmosphere. But we've done a really nice job thus far, and Kristen will be talking about that a little bit more in the presentation. Number 4 was to create teams of staff and youth. And this, again, was specific to building relationships. So when you have the same staff working on the same unit or within the same milieu with the same youth, those relationships, understanding of each other start to develop and provides a sense of safety and support for the youth. Number 5 was to optimize the use of our state and contract capacity. As I mentioned, we have 10 state-operated secure youth centers in Colorado, but we have a significant provider community that does tremendous work for us. And the goal is to really know and understand who needs to be in a secured youth center and who needs to be out in either a staff secure or a community-based placement back in their region close to home. And so it was really important for us to work on this and ensure that we're getting the right youth in the right bed for the right services. Number 6 was to continue to flesh out and increase our behavioral health framework and to develop a system-wide treatment approach. And we've done some really good work in this area to date, but we believe we have a long ways to go to really get to where we want to be. We've had a lot of great work in this area, brought in a lot of subject matter experts from outside the state to look at our system, and we have a lot of exciting new things on the horizon to enhance our treatment delivery. Number 7 was to condense and simplify our training for our staff, most notably our direct care staff. With the young workforce, lots of times we end up trying to train them in things that we've learned over 10, 15, 20, 30 years, and it's simply overwhelming. And so we really wanted to focus on what is it that we want them to know, what are the foundational pieces we want them to know so that they can come into our youth centers and be well-performing staff and feel confident in what they're doing. Number 8 was integrating trauma-responsive principles and practices into all areas of DYS. Again, as I indicated earlier, our trauma-responsive approach, our model, is about not only in youth centers, it's in our regional offices, it's in our central administration offices, it's working with families, that it's about youth and staff and families as a whole in terms of looking through the trauma-responsive lens and how we deal with each other in our day-to-day operations. And number 9 was inevitably the recruiting, hiring, and retaining of quality staff. which is always difficult in this field. But we do believe that the key area here is around retaining quality staff, and by changing our environment and advertising, recruiting, and bringing on a different type of staff. And when I say different type, different than what we used to advertise and interview for when we were more of a correctional entity as opposed to a service delivery model, and creating an environment that they want to work in, they feel safe in, and they can be productive in. So I'm going to turn it over now to Kristen, who is going to talk to you about the Colorado Commitment Continuum model.
Our Commitment Continuum model highlights how we're going to serve youth and families within our care. And Anders really touched on it, but we are not a finished product yet. And I think, it is our responsibility to continue to enhance services to meet our clients' needs. And we are doing so in the context of what we are calling our Colorado model. So if you want to move to the next slide. As we continue to service kids in the state of Colorado, they're looking dramatically different than they did 10 to 15 years ago. We're seeing, as I'm sure everybody else is, an increase in complex mental health issues, in substance abuse disorders, and also, just a genuine kind of presentation around trauma symptoms and an ability, I think, on our part to better understand and identify who those kids are. So what we developed within the state of Colorado, because as everyone knows, there's not an off-the-shelf product, is what we're calling the Colorado model. And we really place staff and youth outcomes in the middle. So when we talk about youth outcomes, we're talking about safety, increasing resiliency, reducing their risk to reoffend, improving their family and natural support connections, achieving educational progress, and really ensuring a reconnection back to their communities. And when we talk about staff outcomes, we're talking about some of the same things. How do we increase their safety within our care? How do we increase their resiliency? How do we improve morale and retention and improve outcomes for professional development for our staff? So as you can see, we kind of have bullets around there. So, Anders talked a little bit about creating safe and trauma responsive environments. We're going to touch on that a little bit more, but what are we doing in those areas? We have retrained in verbal de-escalation. We have refined our training process. We are focusing in on sound milieu management practices. And we have integrated safety and self-care plans for both staff and kids. The other thing that we've really started to focus in on is around staff and youth wellness. We've also focused in on staff and youth resiliency. So, part of our trauma responsive model is how do we instill hope both within our kids and families, but also within our staff that they can see the impact to kids. How do we teach skills? How do we support educational achievement? And we are in the process of developing a staff coaching and mentoring program. Anders touched a little on, but part of the premise behind creating trauma responsive environments is an increased focus on the relationship. So as we move from a more punitive model to a more therapeutic model, how do we really stress and reinforce relationships and the development of therapeutic relationships with our kids? In terms of ecological approach, how do we involve families more actively in our processes? How do we support a multidisciplinary team? And how do we support adequate transition planning for kids entering and leaving our system? Our integrated service delivery, so we have a seamless case management system I'll talk a little bit more about, but we have a client manager that's assigned to each kid upon commitment and follows them through parole. community collaboration. How do we increase natural supports for our kids? So when they're in our care, you know, that's for such a short period of time. How do we ensure that this is sustainable and the changes that they have made are helpful as they transition to community? And we've really focused in a lot in the last 5 years around data analysis and reporting and ensuring that we're using this data as we make decisions for our kids and families and staff. So next slide speaks more specifically around youth outcomes. And again, you know, that they're safe and resilient. They have improved family connections. And when we talk about safety, again, we're talking about not just physical safety, because I think that's an easy thing for us to focus in on, but, you know, how are staff and kids psychologically safe, socially safe, and morally safe in our programs? How are we providing services that decrease risk? So a focus in on EBP curricula in detention and for our committed programs. And how do we teach and reinforce skill development? So we have programs such as ART or Skill Streaming the Adolescent in even our detention programs. So whether we have the kid for 24 hours or for 2 years, how do we really teach the kids skills and reinforce those skills? And in terms of natural connections and family connections, we are really trying to increase family treatment. We have orientation programs, family advisory groups for a number of our committed programs, parent support groups both within our facilities and in our regions that support the kids. And we also involve them in participation in activities with their kids and things like parent-teacher conferences. Staff outcomes, talked a little bit about this already, but, you know, focused in on staff wellness. So, you know, I think one of the things we've tried to pay attention to is, you know, if we say we're doing it, how are our practices supporting that? So we are really looking at the use of overtime and, you know, our staff being there, you know, on double shifts and all those things is really kind of come to an end for us in most cases. You know, it's not helpful to have staff there for 12 to 16 hours a day. They're not refreshed. They're not focused in on the relationship. We also have a recruitment and retention campaign going on for friends and families that are referred by our staff to work for us. And they all get kind of a bonus at 90 days and again at a year. So how do we attract people that A, are going to stay and also have an understanding of what we're doing and the direction we're going? I talked a little bit about that we've developed and are in the stages of implementing a trauma responsive supervision and coaching model for our staff, and we're really excited about that. We have lots of celebrations with our staff, spot awards, and an increase on professional development opportunities. Next slide. So in terms of practice elements that were reflected in our Colorado model, we again adopted the sanctuary model about 4 years ago, and we have really tried to center our programming around the 7 commitments. And, you know, one of the 7 commitments is, you know, nonviolence, and another one is open communication. And how are these commitments integrated into our level system, into themes of the month for kids and staff, and how do our reinforcers support our staff and youth modeling and using these 7 commitments? In terms of trauma assessment and treatment, we adopted the UCLA PTSD Trauma Index for all new commitments. And that is one of the assessments that we use that really kind of informs us around a youth trauma history. I talked a little bit about safety plans. All of our staff and kids have safety plans. So, you know, not only do we identify triggers for staff and kids, but in the moment, what are 4 to 5 tools that they can use to de-escalate? And for all staff, we have a self-care plan and an increased focus around wellness for them. Anders touched a little bit about small group processes. We really had a model that focused more around individual interventions, which is helpful for some of our kids, but how can we address and create safety through group processes? We created a problem-solving group to address kind of those in-the-moment safety issues, and we adopted an appreciation group. So how do we more formally recognize both kid and staff success? And the development of teams, how do we have the same group of staff working with the same group of kids? And if we say we're focusing in on the relationship, how do we ensure that we do that through supporting the development of small teams in our programs? Next slide, please. So again, a focus in on relationship, really identifying strengths of kids, talking about what those therapeutic relationships look like. And we've changed our job announcements and our post descriptions and added information on our performance evaluations that speak to the development of relationships. Home-like environments, we have been changing kind of what our facilities look like through paint and furniture and comforters, self-care rooms, which we're going to get into a little bit more. Again, freeing leadership to engage with kids and staff, focusing in on involving kids in our approaches. So we have youth advisory councils. So as we make changes to physical plant, we're involving the kids in those processes. Next slide. Ecological approach. How do we, again, focus on family engagement, multidisciplinary teams, transition planning, educational and vocational successes for our kids, and restorative community justice. Next slide. Integrated service delivery. I talked a little bit about we have a multidisciplinary team process, and we are continuing to enhance. Next slide, which is integrated service delivery. I'm going to go, there we go. Focusing in on our milieu-based treatment approaches. So we created behavior expectations for all 10 of our facilities that staff and kids follow, and we had reinforcement in all 10 facilities. And again, we've introduced and are integrating trauma responsive practices. Next practice element is community collaboration. I spoke a little bit about this already, but how do we further enhance transition and parole services? So successes that our kids achieved in our programs, how do we sustain them in community through collaboration with families and community partnerships? Next slide is data-driven decision-making. And I talked a little bit about this. In addition to kind of our data measures that we collect around fights and assaults and physical responses and seclusion, we also participate in PBS in currently 4 facilities and are going through the accreditation process with NCCHC. Next slide is around focus on staff and youth resiliency. I've really touched upon these. Some of these are duplicative, but I have spoken to all of these throughout the other ones.
So next slide. So we're going to talk a little bit about transformation taking place within Colorado's Division of Youth Services. And again, back to the onset of the strategic plan and our foundational pieces, that we are working diligently to move away from a punitive juvenile correctional environment for all the things that you've heard leading up to this, continue to move forward with sustaining a trauma responsive organizational environment. And we continue to receive consultation and ongoing trainings in this area so that we can stay on the cutting edge and our staff can stay sharp in this area. But most importantly, it is really about having to shift the culture. As I said, nearly 1,200 employees, many of which have been in the field for a long period of time, more set in the notion of corrections, as opposed to a change in environment and how we see youth, how we work with youth, and our expectations. And I will say that we had a lot of our staff that engaged our change, but we also had a fair amount of staff that did not. But we knew that was going to come upon us when we moved towards this change. And so we really believe that, the mission of the juvenile justice system is fundamentally different than pure corrections or adult corrections, and that we are dealing with youth that are widely immature, they're impulsive, they're young, they're risk takers, and they come to us with significant trauma backgrounds. And so, the overall juvenile justice system holds the youth accountable through the judicial process, but we're designed and we're tasked with addressing the cause of their misbehavior while also focusing on their victims and ensuring that they understand that they have also left victims in their past. Believe that we're tasked with fostering healthy adolescent development, that we should always be tapping into their strengths so that we can help them meet their full potential. And it's about reducing reoffending. And so we're tasked with introducing a young person back to society, and we want them to be a successful member of that society. And so overall, we're tasked with caring for a human life, and that's one day at a time, every day, and really pushing that focus with our staff and our culture change. And most importantly, that coming to a youth services system where your freedom has been taken away in and of itself can be a traumatic childhood experience. And so we have to take that into account each and every day we're working with a young person. And if we're not creating the right environment and the right services, then we're only doing it wrong. And so we really need to put a strong focus on doing it right, and again within the context of creating a trauma responsive organization. Next slide. So in 2017, February of 2017, there was a report that was done on Colorado at the time Division of Youth Correction System titled Bound and Broken. And it was about 21 youth that were interviewed, and some of them, their families, around the negative experience that they were having within the youth correction system. And we took that report very seriously. We were certainly working on our own vision and mission and strategic plan prior to this coming out, but it certainly was something that for us in Colorado was impactful because we take every experience that a young person has seriously. So you fast forward 1 year, because our leaders within our organization, our leaders in the field, our staff have done a tremendous job in embracing where we're going as an organization. And you'll see that within 1 year in our Denver Post here in Colorado, sold down by nearly half as reforms take hold in Colorado youth lockup centers. And then, of course, the other one, taking prison out of youth corrections slowly but surely, is a good sort of takeaway for us in 12 months where we were at in terms of how we were being looked at and where we are today. We've also been fortunate to have many other write-ups around our decreased reliance on the use of seclusion, and we'll talk about that a little bit later in the presentation. So Kristen's going to talk about our accomplishments from our transformation.
Next slide, please. So again, it's really about how do you align your practices and policies with what you say you're doing. So one of the initial things that happened was we changed our name from the Division of Youth Corrections to the Division of Youth Services. And when I think about the word corrections, it to me is more just about supervision and oversight of our kids, but the word services really speaks to partnering and teaching and mentoring with our kids. We eliminated pressure point pain compliance techniques, so we changed our entire physical response protocol. We had something in place for upwards of, I would say, 20, 25 years, and we changed that within the last year. We eliminated the safe restraint device for all youth. I'm not sure if you guys are aware of what that is, but in my mind, I'm a social worker, so it looks much more like a straight jacket. We also eliminated strip searches. And at the right-hand corner, if you can see that picture, we made a decision to go away from having a youth strip naked in front of us, and in turn, being that it would be more humane and they would be able to maintain more dignity and respect, we have them use a gown, and we have a personal search process behind that. You can see that's Anders on the right-hand corner. He wanted to try on all the gowns for us to see if in turn they covered a kid and we could still perform an adequate search. We also have assessed all trauma responsive practices currently going on in our facilities and setting goals around how to move additional ones forward. Next slide, please. We changed the name of our correctional security officers to youth service specialists. We removed scrubs from clothing for our youth. So in 7 of our 10 facilities, they had scrubs still, and we have gone to khakis, polo shirts, sweatshirts, and the majority of them allowing to have their, kind of own shoes. We replaced metal beds in a number of our facilities with a thicker mattress. We went from kind of a correctional I would say 3-4 inch mattress to it's not a Tempur-Pedic, but it's probably a 7 to 8 inch mattress, so kids are more comfortable. Hopefully they're sleeping better, and in turn, having less sleep issues for us to help them address. We successfully requested and received additional direct care staff. So our staffing ratios have gone to 1 to 8, 1 to 16 in 7 of our 10 facilities. And as of July 1st of this year, we'll receive the additional staff to go to those ratios within all of our facilities. And then in the right-hand side, we really try to get our kids out in the community. So, how do we involve them in extracurricular activities, hiking and biking and painting murals in the community? So you'll see on the right-hand side them participating in a hike. I think that's from our Grand Mesa program, our Grand Junction program. Next slide, please. In addition to changing our kid dress code, we changed our staff dress code. We wanted our staff to feel more relaxed in their approaches with kids, less buttoned up, and our staff have really embraced the new dress code. We used to have set kind of colored t-shirts, colored shirts, polo shirts, and in turn they're allowed to wear any kind of collared shirt. They're allowed to wear jeans and shorts. And they have really appreciated that change. And even our families and kids have acknowledged it also. I talked a little bit about our focus on our 2-gen family approach. So how do we engage families even within our detention programs? You can see on the upper right corner, we've shifted all of our visit rooms that used to kind of have plastic chairs and tables to leather sofas, chairs, tables, artwork that the kids have created. We had outside professionals assess our safety and treatment within our trauma responsive environments, and we've started to get back those assessments and are really trying to action plan around how to move some of the recommendations forward as we continue to grow. And again, focusing in on verbal de-escalation and building relationships with kids. And on the left-hand side, that's from our Platte Valley program in Greeley. They have a bike club, and so they have all the bikes donated that were broken. They fix them, and then they take kids out in the community. They also have a fly fishing club out of Platte that does the same with our kids. Next slide.
So I'm going to talk a little bit about seclusion in our system. So we made a decision back in 2014 that we were going to move away from, at the time was called long-term seclusion special management programming. where a youth could spend many hours, if not days, because of behavioral issues, not as a consequence, but as an intervention, which we went away from in 2014. In 2015, we put a lot of work in with some key stakeholders here in Colorado on transforming our seclusion policy, again, with trauma responsive lens in mind here. And that went out in 2015 and ultimately was codified into state law. And so our policy is in statute right now. We worked diligently with our staff, again, training them on de-escalation skills, improving relationships with youth, things of that nature to give them more tools. And what you will see is, as an outcome, where we're at right now is that seclusion averages statewide. Again, this is 10 youth services centers across Colorado, that at any given day we could be serving upwards of 650 youth, that we average a low of 33 minutes overall. This was in January of 2018. And our numbers, sorry I don't have the updated numbers here for you to see, but January, as you'll see, was 33 minutes, and we had a low in March of 28 minutes as an average time that a youth would go into seclusion. So again, we never use seclusion as a consequence. It's only if they're a probable, imminent, or serious threat of bodily harm, or to create an emergency. So our staff, when they have to use it, are getting them out very quickly. We had 0 incidents of seclusion over 4 hours in length for any one single episode in the entire year of 2017. And comparing that to nationwide seclusion use for youth, and again, Kristen mentioned PBS, which is our performance-based standards. It's a national data collection system that states can participate in, shows that the average time a young person's in seclusion is 15.4 hours for committed youth and 5 hours for detained youth. So you'll see here we had a 70% decrease in the use of seclusion starting in October of 2016 through January of 2018. And if you go to the next slide, it details that out for you a little different here. So the pink line above is the national average that I was speaking about. The blue line is seclusion incidents that we had. So if you start back in 2016, upwards of 300, down to under 100 there in January of 18. And then the red line along the bottom is the average seclusion length in hours. And so you'll see that we are, on average, we're well under 1 hour of time. And as I mentioned before, saw a low of 28 minutes across our system. So if you go to the next slide, typically what you would hear in this case is when you go away from things like seclusion, you're going to see an increase in behavioral acting out. And I see here that actually Kristen's going to go through these slides here on our seclusion rooms and our relaxation rooms, and I'll get to my point here in just a second.
So when you're trying to make, changes, we have to provide alternatives to staff and kids. And one of the ideas that we came up with was creating self-care spaces in all of our programs. And we're really in the midst of this now. The majority have at least one. And they're really, trying to provide a safe space for kids with activities that would help de-escalate them. So there's music, noise canceling headphones, activities, coloring books, I was trying to think, fidget spinners, and tons of different activities that the kids can engage in. And on the right-hand side is a typical seclusion room within our facilities, and to the left is what we've tried to do in terms of providing an alternative. And you can go to the next slide. These are additional self-care spaces within our programs. One of the nice things that's happened is staff have really partnered with kids around what would be helpful for them as they develop these rooms, and even the painting of the murals in our facilities have been done by the kids. Next slide.
So getting back to the point that I was going to make, when we looked at, as we've transformed into a services system and went away from many of our old correctional practices that Kristen was outlining in our changes, and I was talking about, reducing the reliance on the use of seclusion, which we've been able to do dramatically, that the response you typically get as you start to embark on something like this is that safety issues are going to escalate, youth are not going to be safe, staff are not going to be safe, and outcomes are going to go in a different direction. And so this particular slide, the data takes us through January, and what you will see here is not necessarily, I'm not trying to demonstrate a vast reduction in youth on staff assault. It's more showing, even though it's on the decline, it's showing that when you go away from traditional correctional practices and move in the direction that we have moved, that in fact, we do track this from a data perspective, and we're not seeing more youth on staff assaults as a result of not having a reliance on the use of seclusion. And on the next slide here, you will see that we're also tracking youth on youth assaults, which we do every month. Again, the same story. Not showing that there's a dramatic decrease, although this one is showing a slight trend line going down. It's that it's not going up considerably like we would suspect that it would overall. And this is aggregate data across all 10 of our youth centers. And so some of our youth centers are certainly making up for some of our data in terms of having low youth on youth assaults and youth fights overall, and they're, our other facilities are certainly moving forward with that and making good progress as each one is implementing our new programming and moving forward. And so the last one here, you'll see, as we talked about on the last slide, we had a device that was called the Safe Restraint Wrap. Did look a whole lot like a straitjacket. Your legs were bound and you were handcuffed, and that was used as an intervention for youth when they were behaviorally out of control and violent. And our system, I'll tell you, even looking back a year or year and a half ago, would have never imagined that we could operate in our youth centers without such a device. But our staff embraced the elimination of that device, and you can see there as we tracked the elimination of that. We had a goal to get rid of it by July of 2018, and we were able in our system to get rid of it 6 months early. So the last usage in Colorado was November 17th of 2017. Another example of going away from practices that can be very traumatic for young people, but still having good outcomes. So that's a quick 40-minute presentation for you, maybe a little long. I apologize, just to give you a little bit of an overview of what we're doing here in Colorado in our youth services system, and happy to answer any questions.
Anders and Kristen, that was such an amazing presentation, and we've gotten already a lot of comments of people saying thank you and just really excited to see what you've been able to do in changing to a trauma-informed environment. And your data and your outcomes are really impressive. So we'll just kind of share some of the questions that we're seeing and let you all just to take a few minutes to address those. The first question I'm going to bring to you actually is coming through Twitter from Ireland, which is very exciting. and basically wanting to know what drove you all to change these practices from where you were to this trauma-informed approach.
Yes, thank you for the question, and I'll start, and Kristen probably has an answer to this as well, but I would say that really that looking at research, being in this field for years, and truly just having a genuine care for the kids that come into the Division of Youth Services, and believing in them, and and understanding that they're not adults, they are young people, and you have to really understand their backgrounds to make an impact on them. And making an impact on them when they're with us, again, allows them to be productive citizens when they return to the community, and live a good life. And that's really what we need to be about, in my opinion, in the youth services system. And so when I was fortunate enough to come into the role here as the director, I had a lot of experiences in my career, and now have the opportunity to work alongside people like Kristen and many other very talented leaders within our division to make policy changes to put these type of things into place system-wide.
And I was just going to add that, I've been around for probably upwards of 25 years. And when I first started, there just wasn't a lot of research around what was helpful with this population. And as we gathered more information and had more research behind what's effective, and we tried it, I think we had some successes with it. And I also think our staff were asking for changes. They wanted to be in more roles around coaches and mentors and guiding our kids as opposed to correctional officers. So I think we had a lot of support around us. And Anders talked a little bit about, it's kind of that bell curve. We had some staff that wanted to, kind of go, and then some staff that didn't. But I think as they've had some successes in building relationships and using some of these different interventions and feeling safe doing so, I think that helped drive the change, and has also maintained our momentum, because I think we're really just in, some of the early stages around moving these initiatives forward, and hopefully will become even better.
Thank you so much. Those are fantastic gems that you shared with us there about what drove you to make these changes. I do think here at Grafton and within Ukeru systems, we've also found that understanding the backgrounds of the individuals that we're serving, and viewing them with kindness and compassion, changes the way we approach treatment. And being able to keep staff safe while they're approaching clients in a therapeutic manner helps staff be able to maintain that level of therapeutic intervention. So that's amazing. I know one person's asking about services in Arizona. I'm not sure if that's for you all or for us. So I'll ask you first. Do you provide services in Arizona or to children from Arizona?
We do not provide services in Arizona or youth from Arizona, no.
Okay, and for Grafton, we are a behavioral health care organization. We work with children with developmental, intellectual, and psychiatric challenges. We could serve children from Arizona, so hopefully that answers that question. One person was asking if you're going to be looking at your rates of recidivism based on kind of your new approach, and if you are, for how long?
So yes, is the short answer to that. We will absolutely be looking at our recidivism rates as we move forward. Now, Colorado has been tracking recidivism for years on end, and it's on our website. The reports are there. We're always 2 years out in reporting the 1 year recidivism rate. So the definition in Colorado is that once you are completely released from the Division of Youth Services, that we track 1 year, 2 years, and 3 years, that if you have an adjudication or a conviction, then that is considered a recidivist act, and that will go on our report. So again, we do 1 year, 2 year, and 3 years. Those of you that know about recidivism reports in different states understand that there is not a common definition. So we really have to gauge ourselves against ourselves for the most part. And then you also have to understand that as two extreme examples, when I looked at our last year's recidivism report, I had somebody that had an attempted murder, and that makes the recidivism report. I also had somebody that had a dog at large that made the recidivism report. The year prior, I had a youngster that was fishing without a fishing license. So, not to downplay it, we always have ongoing recidivism reports. We take them seriously. We look at them. We try and find trends. But also on the back end of that, because of the definition, as an example, if your dogs are at large, you still probably could be hopefully a productive citizen. I jokingly said we should discharge all of our kids with fishing license, but we will be looking at that. And as we've embarked on this, we're always going to be 2 years out before we get the first year recidivism report.
Thank you so much. And I know we have about 3 minutes left. One question asked if you could share a little bit more about what you train and use as verbal de-escalation. Can you get into that a little bit more?
Yeah, we certainly can. So verbal judo is primarily what we work off of, as well as training all of our staff in motivational interviewing. So those are two real key areas that they get training on, and they get retrained on that on a yearly basis so that they're always staying up to speed and sharp on their skills. In addition to that, it is also pushing the strength-based, relationship-based approach with youth. So again, we talked about creating teams of youth and staff, small group processes, again, strength-based, relationship-based, and also training them and providing them tools through verbal judo and motivational interviewing has been our efforts thus far in making progress in this area.
I was also going to add, more informally, we have, a really comprehensive kind of briefing process with our staff daily. So really trying to better understand who our kids are. And you touched on this a little bit around, better understanding who we're serving, what their triggers are, what are specific interventions that people are finding to be helpful, and how do we convey that to all of our staff. So really using our briefing process, team meetings to, further discuss our kids. And I talked a little bit about safety planning, so that every staff is aware of the kids' safety plans. They carry them with them, and they reference them in terms of skills that they could be using in the moment. So not just, around a training process, but how do we reinforce better understanding our kids daily? The other thing that I didn't mention is all of our kids get a trauma psychoed group. So both our staff and kids are going through that daily to better understand the trauma symptoms, and so that they can intervene and use, hopefully, skills prior to having to use de-escalation, just through better understanding who we serve.
Thank you so much. I know here at Grafton and using Ukeru systems, we use a lot of a philosophy called comfort versus control, and that as a trauma-informed approach does a lot for de-escalation, and hopefully we'll have a chance to talk about that another time pretty soon. And so just to be sensitive to everyone's busy schedule, we're now at 3 o'clock, and it's the conclusion of our time together. There were a lot of other questions, so what we'd like to do is work with Anders and Kristen on getting answers to those questions and getting those answers out to the group. We just want to thank you both, Anders and Kristen, for presenting today, and thank you to everyone who joined us for this discussion. We hope that this is not the end of the dialogue, but just the beginning of this very important conversation. Please stay in touch with us. Be sure to follow the hashtag #StartsWithYou on Twitter. Certificates, if requested, will be sent out within a week to 10 days. And on behalf of all of us here at Ukeru Systems and those of us in Colorado, thank you once again for joining us, and have a great rest of your day.